Namaste. I am Dr. Sheela Chakravarthy. I head the Department of Medicine, Fortis Bannerghatta Bangalore. All of you have been hearing recently about this monkeypox. I just want to give you a small briefing about what is this all about and how do you really take care of yourself. Monkeypox is a family of orthopox virus, which is similar to the smallpox. And this originated in the monkeys of Central and West Africa. And some of these rodents which were in contact with these monkeys seem to have got the infection, and from there it has transmitted to the human. So the first case incidentally was picked up by a person from India who went to Southeast Asia and was diagnosed with monkeypox, although he was not the first detected case in India. But a large number of cases have been discovered across United States, now about 3,000 cases in the United States. It's going to definitely pick up in India. So what should we know about this monkeypox? This monkeypox is like a smallpox virus, but it is transmitted from a rodent or from a monkey. The source is not from a human. It is animal to human transmission. But once it happens to a human, then the transmission occurs from human to human. So which kind of people should we be wary about? Most of these patients who have this monkeypox virus have an incubation period, that is the time required for the virus to multiply, goes from 1 to 21 days. So the average is around 12 days. So if anybody has found to have a fever and after 12 days starts to develop a rash, and this rash starts from the face, it's initially seen as a rash inside the mouth and in the tongue, then goes onto the face. From there it moves to different parts of the body. This is called as a centrifugal, that is away from the center, and this kind of distribution is very typical of monkeypox. The most characteristic thing apart from the vesicles are there are large number of lymph nodes which are swellings which are found in the neck, particularly around the tonsillar region, upper part of the neck, under the chin. So these areas, if anybody is found with a rash and with these lymph nodes, you can be quite sure that this person may be suffering from monkeypox. So how does it spread? So if a person has these open lesions and if somebody is in contact with that person for a very long time, which could be in the form of physical contact like hugging, kissing, or it could be holding their hands, taking care of them, their clothes, or it could also come through sexual contacts. So anybody in close proximity is those which are at high risk of developing a monkeypox. But how do we get the monkeypox? We can get when their secretions, when somebody is using their coughing or sneezing, they can pass on the secretions to us when we are in contact with them during the incubation period. So it is better to continue wearing masks not only for COVID but also for these monkeypox viruses which can spread through respiratory secretions. So once you have been diagnosed with monkeypox, what are the symptoms? So basically, like any other virus, the patients generally have fever, body ache, and extreme tiredness. The most diagnostic thing is the presence of a rash. The best way to prevent and avoid this is first, report in case you find a high risk. Second, bring it to the notice of the epidemiologist or the hospital to confirm the diagnosis. Isolate the patient away from everybody because we know it comes through close contact. And be very careful in not spreading this infection because we are just not recovered out of COVID. We cannot afford to have the monkeypox torturing us. However, the only good news is the risk of death, mortality is 1 to 10%. And since it is not rapidly and rampantly spreading, we could definitely avoid this by taking care of this. Thank you very much.